Okay, good morning. This is Edward Ng with Pittsburgh Foundation. Thank you for joining us on our monthly COVID call. Just to remind everyone that we are recording the session for redistribution later. And if you have any questions, please type them into the question box, and we will answer your questions later on in an email. And we also have 3 handouts today. So if you go down to the handout section, you can download the PDFs that have been included. With that, I'm going to hand it over to Phil Koch.
Hey, thanks so much. Appreciate it, Edward. Happy that you're here to help coordinate our technology. It's really helpful. Thank you, everyone, for joining us today for this month's moment to connect with each other and to learn about the responses that are happening at various angles to make sure that we have a healthy community and that we're supporting people through this pandemic. My name is Phil Koch. I'm the Vice President of Policy and Community Impact at the Pittsburgh Foundation, formerly the Executive Director of the Community Foundation of Westmoreland County. So you may have heard that I've taken on this new role at the Pittsburgh Foundation. I plan on continuing, though, my work in Westmoreland County until we find a replacement for the Community Foundation of Westmoreland County. So I'll continue to host these calls until somebody's in place. And I won't be going that far away. My new role will have a regional impact, and so I hope to be working hand in glove with the new director once we have somebody on board in Westmoreland County. So, but I want to focus today on why we're here. So we've got a great lineup for today. We've got Alyssa Chorlowski from the United Way. We've got Sarah from the county. Commissioner Doug Chu is with us, as well as Bud Mertz, Dr. Conway from the intermediate unit, as well as Jennifer Miller, Deb Thakura, Dan Carney from Union Mission, and then finally Jordan Cleo from the Hill Group. So we've got a really great group of folks, and we'll get all the information to you as soon as possible. I do want to take a moment to thank the Westmoreland Museum of American Art for the painting that you see on your screen today called Old Sawmill by Alfred Wall. And it was painted in the town of Lilly in Cambria County. This is an unusual subject in that the artist tended to depict spring, summer, and autumn since he worked outdoors. This winter scene shows the lively activity of a small community, boys sled riding, men stopping along the path to talk, and the warm offerings from the inside as the chimney smoke comes from the hearth. So nice scene for a good winter day. But let's get to work. I'm going to pass it over to Alyssa Chorlowski from the United Way to give us an update. Alyssa.
Thanks, Phil. That was a beautiful painting. I really like that one. I'm also glad I chose green today to match the PowerPoint. So nice to see everybody here, and thanks as always for all that are joining our call. Just wanted to bring up 211 and some of our statistics. We are seeing an increase in call volume, over 1,000 calls in the month of November, plus an additional 100 to 200 of chats and texts and other ways that people are communicating with 211. 43% of these calls are around housing and shelter help, and 80% of those are people asking for rental assistance. And that's we've seen that increase over the last couple months, and I think we're going to continue to see that going up. 30% of the calls are utility-based, people asking mostly for help with their electric and water bills. About 76% of the calls are for that. And then other people are asking for help with gas. 10% of the calls are for food, but 92% of those calls are people calling for food pantries. And I know Jen's on the call and she's going to talk about that too, but we're seeing a big increase around that. And interesting, I thought too, we're seeing an increase in people asking for clothing and household help. So calling to look for personal hygiene, for clothing, for other supplies, and for their house and for their children. So, I think this is a trend that we've been watching and we're concerned about. We do have the help for emergency basic needs. People can call 211 to access that. So continuing to follow those calls and appreciate everybody who updates their information and then also spreads the word on 211. People still in the community don't know that that's a 24/7 resource line that they can call in with any kind of question around human services and access. I wanted to say thank you to everyone who filled out their human services study. Jordan's going to talk about some of the results, but really appreciate that. I know it was kind of a heavy lift in terms of a lot of questions and information and data that we've gathered, but it's really important information. And I think we're seeing some interesting trends there for next year that we can start some planning around. And then just a quick reminder, the cold weather shelters are open. So when the outside temperature drops below 25 degrees, if people don't have somewhere to sleep that's safe that night and warm, they can call 211, get access to the cold weather shelters. Our great partners, Union Mission and the Welcome Home Shelter, are available. In addition, if those are filled, we have the ability to put people in hotels and also to provide transportation. So it doesn't have to be someone necessarily close to Greensburg in need. We can arrange for them to be picked up and brought to one of the shelters. So that's what I have in United Way news. So thanks, Phil, and everybody.
Great. Thanks so much, Alyssa. Appreciate it. We're going to pass it on over to Sarah Stenger, who's the interim administrator with Westmoreland County Behavioral Health and Developmental Services. Sarah.
Hi, good morning, everyone. One of the attachments is we have a new flyer out. We had already started through our crisis and DCORTS, our assistance programs for the community. We had already had the COVID support line, and now we want to expand for first responders. We want to make sure that we are touching the healthcare workers. We've gotten a couple calls to set up some debriefing and to offer some support groups, but we do want to have that option available to the community. I know this is stressful for everyone, especially in some of these care homes and hospitals where they are seeing an increase in services. So this line can help them. They can call and talk with a professional, and if needed, we can help them arrange to get into some services quickly. So we wanted to make sure that we are getting this out and passing the word on this. We are starting to get a couple calls, so we're hoping that we can touch base and help. As far as that tracking grid, can somebody put that up? This is just our normal DCORT flyer. On the database grid, that's, I don't know, maybe it wasn't attached. Okay, with the monthly tracking forms that our office is doing, we have been able to reach out to some of the providers and get some updated statistics, but we are trying to touch base with some other to try to get some more back data. We are seeing an increase with some of the drug and alcohol, with the community's student assistance program. The referrals for the drug and alcohol side are really up. There was only 3 referrals sent over in 2019. And there's already been 12 so far last month. Drug and alcohol inpatient is really seeing an increase. There was 84 in 2019 and 109 for last month. Let me see. Feeding the Spirit, I believe Deb is on the phone, that their last month's statistics were they served 278 people in 2019. But last month they had 679 calls for assistance. So that's really an extensive uptick in cases. Rental assistance requests, as we believe those are also up. There was 18 in 2019, and so far there was 68 reported for 2020. One of the areas where I saw that was really down in numbers was for the Area Agency on Aging. Some of the abuse report numbers were down. They had reported that there was 111 cases in November of 19 and only 85 reported in November of 20. So we're hoping that things aren't being missed there, but I'm sure they're doing a great job with outreach and continuing to serve. Another area I wanted to give an update on, we had some retained revenue spending that we were able to try to put into a new plan for services. So we're waiting on OMSAS approval to offer it's CIT. It's the training for first responders, critical intervention training to deal with mental health consumers out in the community. It's a week-long training. So we have we're waiting for approval for that to be able to offer it. We've been able to offer it in the past with other grants and other funding, but right now those are all dried up. So we're hoping to be able to use this funding to offer at least 20 to 30 to offer. It would be for police officers, prison staff, county staff. We've done college police in the past, just a variety of individuals, and they get a stipend for their time to come in. It is a week-long, a very intensive training where they receive certification. I believe that's really the updates I have. Really, our programs are still, we are seeing an increase with some staffing, but right now we're trying to make do and trying to just support as much as we can out in the community. But if anybody sees anything that needs addressed or attention, please just let me know.
Thank you, Sarah, and I appreciate you being with us today. Helpful update. I'm going to go ahead and just as a heads up to everyone else, any of the handouts that you see here, you can download them here. I believe Allison Womer from the Community Foundation of Westmoreland County will also be emailing those to the participants after this call. I want to move on over to Commissioner Doug Chu. I appreciate you being with us. Looks like you have a little one with us too, or you did a moment ago. Glad you're with us, Commissioner.
Thank you, Phil. He's still here sitting next to me, so.
Great, always welcome.
So Phil, you had asked me to talk about the CARES application process for round 2. And I wanted to report that for the last several days, we actually have not had any applications. We have not reached even $1 million. And so at this point, we're kind of thinking that we've covered all of the nonprofits that are in Westmoreland County that showed some sort of revenue loss over 2020. And so we'll probably be closing that down this week. We will get applications out as soon as possible. Contracts, agreements out as soon as possible. The process was very streamlined. The application was much simpler this cycle. And so even with businesses, we were able to turn them around in a couple days. They'll be on today's meeting, and we're hoping that the nonprofits can be on a public meeting Tuesday or Thursday for approval and then contract execution. The money still has to be spent by December 30th, and there is talk of additional monies coming in 2021. And so if I learn more about that, I'll definitely reach out to see if our nonprofits can help in a letter writing campaign to help encourage our legislators to definitely fund the nonprofit circuits. And so unless there's any questions or you wanted to chat about something else, that's all that we really have on the CARES Act funding at this point.
No, that's really helpful, Commissioner Chu. I appreciate that. I know that a lot of our nonprofits, certainly, even the ones that were funded, have additional needs above and beyond sort of the limitations of the requirements that were in the original grant. So the original grant application. So I'm sure that if there are additional funds that are coming in 2021, I'm sure folks will be ready to mobilize and help advocate for that work. So the Community Foundation of Westmoreland County can certainly help with that, and the Westco Nonprofit Network, I'm sure, would be ready to mobilize to help organize nonprofits to encourage that for sure. So please reach out if that's something that you all are interested in looking at.
Sure. I should say, Phil, that there were several nonprofits that applied in the summer and who continued to show revenue loss as the year went on. They submitted a second application in this cycle, and because they did not reach the $25,000 threshold in the summer, they will likely be awarded the balance of what was possible in the summer award. So I think that that's a testament to the Community Foundation and other groups really getting the message out there to make sure that nonprofits realize that they had two opportunities to reach that $25,000 limit. And in this round, we allowed nonprofits to submit simply expenses that would be COVID related, whether that be PPE or or thank you, Luke, or other things of that nature. And so some of them who did not have a furthered revenue loss were able to then put in $5,000 or $6,000 worth of reimbursements. We would expect, I think, to continue that model going forward if another round was to come out of the U.S. Congress.
Yeah, that's really helpful. I know from the community foundation side, you know, when we partnered with the United Way to survey our nonprofits in Westmoreland County and frankly across the state, that was really what we saw, right? Was the decrease in revenue from their limited ability to do fundraising, and their increase in services or in costs related to COVID were really what were the most challenging, right? And so I'm sure that will continue as we move here. So thanks for understanding that. Helpful. Great. Well, thank you, Commissioner Chu. I know you probably have a lot to do, and I know Luke needs your attention. So I'm going to pivot over to Bud. Bud, I know you're going to give us an update on public safety, but I know Dr. Fox wasn't able to join us today, and I think you're going to share a little bit about what Excella is experiencing as well. So passing over to you, Bud.
Yeah, thank you. And again, thank you for the opportunity to continue this great partnership because I think that it really is valuable, especially this time that we're experiencing such a huge surge in cases. And you know, basically that's really what I wanted to discuss was the surge and what that really means because you know, as it stands right now, as everybody looks at these very high numbers, in most cases over 200, sometimes 300, 400 cases that we're getting, it's you know, that means that there are people that you know, are testing positive that then have to go through this 14 to 21 days of being sick and symptom free and all that other stuff, and that has a tremendous effect on the community as well, because those daily numbers are people that can't go to work. And you know, my concern across the board is our critical infrastructure that we see that affects staffing in that critical infrastructure. So I just really want to keep that in mind to everybody that these numbers really do mean something. It's just not a high number. It's a high number that is affecting businesses. It's affecting our critical infrastructure. It's affecting the hospital. You know, the Excella Health has done a wonderful job of building contingency plans for the inpatients that are coming in. But right now, their inpatient volume, from what I've been told, is at least 50% COVID-related inpatient going in. So that 50% needs a special isolation type wing to be on, so that you know, and so they have their contingency plans are in place, how they can expand, and they are currently expanding to receive more patients that are coming in. But their staffing is what the concern is, and again, it is affecting every business, every critical infrastructure that's out there. So, you know, you have the staffing that's either COVID positive, the staffing that's in quarantine because of an exposure of COVID positive, or the people that wake up not feeling that well and not taking the risk going in there. And so you have that with the hospital. You have that with your ambulance services. You have that with your police departments. You have that with your fire departments. And that's what we're seeing right now across it. So every day they broadcast about the mitigations, and you have to, you know, the mask wearing, which is always controversial, but as far as I'm concerned, I don't want to be sick for 21 days, so I'm wearing a mask. You know, the social distancing, the washing of the hands, those are very, very important to reduce the numbers, and basically to stay home, and you know, and not, you know, the unfortunate part is people don't get to, especially in the holiday season, there's no Christmas parties, no Christmas gatherings, but that's very important, because even if you're not tied into one of those critical infrastructures, you can spread it to somebody that is, and how easy this infection is to spread is made obvious yesterday with the governor coming down with COVID. And, just there was not a more stricter person as far as following the mitigations. And so it is a infection that's easily spread. So I just want to throw that out there because we have to do whatever we can. Not only if you're not an ambulance attendant or a paramedic or whatever, but the risk of spreading it into those areas. So our emergency operations center still stays activated at an enhanced level. Right now on our EMS calls, we're seeing an increase of around 12% EMS calls coming in. But that varies at times, and unfortunately that varies during a 24-hour period where you can get a lot at once. So our EOC's staffed at an enhanced level because we've now increased having a county EMS director on call for our EOC up to the point where we have areas or regions in the counties that the ambulance resources become tied up, that we then start making moves so that we can shift ambulances from other jurisdictions into a more staging, into a more applicable area that can cover a bigger area just for that. And again, it goes back to the fact that the ambulance calls are up and the staffing's down, and that's very concerning for us. So we're looking at again probably a 12% increase in our EMS calls as it stands right now. But out of all the EMS calls, we're up to close to 30% of those are screened positive. So what that means is when you call in for an ambulance, there is a screening process that we go through just to see if there are COVID positive symptoms that's available, so that we can notify the responders of that. And 30% of the calls that we're getting are screened positive. So that shows a lot to where we are right now. So there's still a lot of work ahead of us on that. We look forward to the vaccine becoming available. However, just a little note on the inoculation, the vaccination plan that's out there is, first of all, they're expecting, Pfizer to be approved this week, and maybe next week, Madrin, I think is the name of it, is going to be approved next week. But those are limited dosage, and there's not really a lot of doses. I've heard numbers of maybe 6 million doses, and I've heard up to 20 million doses. Nonetheless, that's nationwide, so that's really not a lot. So the federal government, it will have ownership of that vaccine. They're going to shift it to the state. It's going to be up to the governor and the Secretary of Health to then designate where those vaccines would go at limited quantities. And the first thing that they're looking at the highest priority is where the highest numbers are, as far as what type of setting or congregate setting would be the highest numbers. And the second is those most in risk of getting the vaccine. So it appears to me, based on that plan, that the first wave of vaccination is going to go into your health cares, your personal cares, your nursing homes, those type of stuff, as far as where the most of the cases are. And then the second designation, or equal designation, of the most risk is most likely going to be in the healthcare as well as the EMS side of it. As more doses become available, the plan is built like a pyramid, that once you get this group set, you go down and you look at other things. So obviously the first responders and your fire, your police, your other support worker in the healthcare that weren't eligible in the first round would get it as that, and then it branches out from there. I've heard, I mean, there's no numbers because it's all based on the availability of the vaccination. But I've heard anywhere from April through July, and maybe even to August, depends who you talk to, the availability of when you're just going to be able to get it to pull up to a pharmacy, a Rite Aid or a CVS or whatever, and get it. So it's positive, but it's not everybody's going to be vaccinated next week when Pfizer gets pushed out, and they do have a plan to do it. Again, trying to protect those in most need during a pandemic. Other than that, as all of our tactics are still in place, and we still continue with that. Most important is our PPE pushed out to the ambulance services as well as the first responders. We also continue with the 4 pods, the points of distributions for the EMS as we go out there. A little talk about the RICP program, because it's a great program. I hope that it gets funded again for 2021. But that's the program that brings the hospital into the nursing homes when they have a spread of infection. We work very closely with Excella Health in the help support the RICP program through different relationships that we have built, and the commissioners did allow us early on to buy PPE for emergency use at nursing homes. So what happens when an infection spreads at a nursing home, let's say, and if they don't have the enough PPE to last for the RICP program to set in and the supplies that they get from that, we found ourselves going Saturday evenings, Sunday nights, whatever, making emergency deliveries to them of like a 3-day supply until the RICP supplies show up, just trying to keep people protected the best that we possibly can. So we're busy, and we can't do it without the support that we have for groups that are involved in this call, as well as other groups to help us make our mark. But just to then reiterate in closing that don't get the disease so we can't spread it, and we all can go home safely.
Thank you so much, Bud. I appreciate that. It sounds like there's hope in the future. There's light at the end of the tunnel, but we need to continue to follow the guidelines and bear down as we get there. Thank you. I'm going to go ahead and pivot on over to Dr. Conway to give us an update on education and our schools. I don't think we can hear you, Dr. Conway. Is anyone else can? Am I the only one, or can? Nope. Let's try this again here.
His mic is on, but
yep. No, still nothing there.
No.
Nope. Maybe a mic issue or yep.
Yeah, why don't we move on, and maybe I'll work with Dr. Conway and see if I can help him.
Great. Why don't we go ahead and Dr. Conway, just for the sake of time, I'll jump over to Jennifer Miller with the food bank, and then we'll try to come back to you if that's okay. So Jennifer, if you're okay to go ahead and give us your update, that'd be helpful.
I am. Thank you, Phil. Things at the food bank have been pretty steady, needless to say, through the holidays. We didn't see a huge uptick in terms of numbers. I was glad to hear that 211 is sending out those referrals to our food pantries. That's extremely helpful. We are preparing for the influx for Christmas. We are receiving a lot of phone calls, nothing out of the ordinary, just normal holiday type items, or requests, I should say. We are still planning at this point, and I cautiously say that, to go back to our normal type of distribution to our pantry sites in February. That may change depending on what's going on with the virus. We are looking at restructuring our Operation Fresh Express program to be more low to no touch type of distribution. Needless to say, that program had to be canceled throughout 2020 because it's not set up to be a low to no touch type of distribution. So All of the food boxes for the month of November received a turkey. We were lucky enough to have that happen and plan to do that for as long as I'm here. I think it's important. And all of the Christmas boxes or December boxes had a ham this time. So the Christmas holidays may not seem extremely normal to everybody, but at least we were able to get that type of food out to the families that need us the most. So nothing real out of the ordinary, considering the last 10 months and what they've been like. Our pantries are doing well. They're very strong. The network is very strong. Our volunteers are amazing. We still have a lot of volunteers coming in to repack our food boxes and get them out in a timely manner. We are breaking over the holidays. We will be available for emergencies, so that's not a problem. Refer everybody, that you need to refer to a food pantry or to the food bank, and we will get them taken care of. But we're going to give our staff a well-deserved break from the 22nd to the 4th. So, but we will be manning our phones as always, making sure that anybody who needs emergency assistance is getting covered, and answering any messages that we receive in social media or email or anything like that. So as everybody has worked very hard. We're just going to take that little bit of a break. So other than that, we really don't have a lot going on right now, just taking care of the needs as they arise and working hard to make sure everybody's fed.
Awesome. Thank you so much. Appreciate that. I think we have Dr. Conway's audio back. I'm going to pivot back to you, Dr. Conway.
All right. Well, thank you very much. Now, can you hear me? Excellent. All right. Well, Phil, thanks again for the opportunity, and congratulations on your new position.
Thank you.
Two items I'd like to share with the group today. As you know, schools continue to make those difficult decisions of whether to go fully remote, offer hybrid, or offer full-time in-person instruction. And as of today, we have 5 school districts that are offering some type of in-person instruction. That doesn't mean the whole district is offering in-person instruction for every single school, but there are however, there are 5 districts that are offering some type of in-person at some level within their district. So the majority from that is right now fully remote. And that also spans in terms of when that's going to end. We do have some districts who have extended full remote through the end of the first semester that occurs approximately January 18th. We have some that are going to come back right after the Christmas holiday. All of that, of course, is up to how the cases loads look, as we get closer to Christmas and the time period thereafter. School districts did have to sign an attestation form that indicated what choice they were going to do in terms of offer in-person instruction or go with the guidance of waiting for a county to be moderate for 2 consecutive weeks before offering in person. Again, we had a mixture of choices that were occurred within the districts. Most of them did select the first choice of saying that they would offer some type of in-person instruction, which really kind of gave districts more flexibility to be able to offer. For instance, the intermediate unit, we did select that in-person selection because we have a number of students that are receiving one-on-one OT and PT and speech language pathology services. And so even though that number is in the teens, we as an organization had to select that. And by selecting that, what it forces the districts to do is attest that they are going to follow the masking requirements, the physical distancing requirements that have been set forth by the Department of Health most recently. In relation to that, I wanted to share with this group that our early intervention program is currently fully remote in our operations. And so that matches many of the surrounding counties as well that are offering, early intervention. And for the IU, that is ages 3 to kindergarten. The second major topic I just wanted to share an update. As you know, in the summertime, we did receive an RK Mellon grant that would create a library of resources for families who have students between pre-K, early intervention, through 8th grade. And that library would enable families to check out Chromebooks as well as MiFis, giving them the availability to the internet. Unfortunately, much like other institutions, there's such a back order with Chromebooks and MiFis that it's been very difficult to secure them. But we wanted this group to know that we continue to fight for them, and we continue to do our very best to get that library set up as soon as possible. So Phil, that's the 2 things I wanted to share. Thanks again for the opportunity.
Great. Once you have that set up, will you be able to provide us some materials so that we can get out to our nonprofit organizations, our human service agencies that work with families, just to help spread the word about that?
Absolutely, we will.
Great. We'll stand by, and as soon as that's set up, we'll make sure we get that information out. Thank you, Dr. Conway.
You bet.
Great. Let's go on over to Deb Thackerow with Feeding the Spirit. Deb.
Hi, Phil. Hi, everybody. Thank you for letting us be on the call and be part of this amazing group. I think it's vital that we all touch base with each other so that everybody's needs can be met as best we can all do in this time. As Sarah mentioned, we did see an increase with the meals being served dramatically for November. We do our weekly meal distribution every Thursday as takeout and drive-through, and it was increased. 679 meals have been distributed just through November, and that wasn't counting Thanksgiving week, because we did not do a meal distribution as Otterbein Church did their own. So that was just in a 3-week time. We're averaging about 220 meals distributed weekly, and about 75% of our consumers that come on Thursday nights are doing drive-through. We still have, obviously, a few folks that do not have vehicles, so we do take out a walk-up, but because the cases have spiked recently, we made the decision not to let anybody come into the area, that they stand outside and we bring the meals to them. We're trying to be as safe as we can and still get their needs met. As Jennifer mentioned, we look at the holidays and we see we want to make things very special to our consumers. And so next Thursday night, we are going to not only do our regular pot meal distribution, but thanks to some wonderful business folks in the community, they've donated monies that we can provide a small ham to each family. And we have had a private financial group provide gift bags and toys and different things to the children. So we're going to try to make Christmas as bright as we can. And I do believe Santa Claus will probably even be in the parking lot distributing that. The other thing that we see, to just kind of continue what Bud was saying about things increasing, we do see the ripple effect now of people being quarantined and families being quarantined for 14 to 21 days. And on our side of the ripple effect, they can't go to work. And a lot of times the consumers that we serve, they don't have the ability to still get a paycheck. So they're seeing 2 to 3 weeks of no pay. So some of our rent assistance calls for December have been because of that, because they've had to quarantine and they can't go to work and their employer doesn't offer any compensation for that. So we have seen a huge increase in rental assistance calls, and part of that is because of that. I think in 2019, in November, we had 18 to 20 rental assistance calls, and this November we have had 68, and that's just huge in a 4-week period. And I think December is only going to increase. So we watch those numbers and we prepare like everybody else, and we do the best to serve everybody in need. And we will continue to do that with everybody's help that's on this call. So thank you very much.
Thank you, Deb. Appreciate it. I'm glad Santa's going to show up in Greensburg. Let's go ahead and move on over to Dan Carney, who's here with Union Mission, who can talk to us a little bit about housing in Westmoreland County.
Thanks. Appreciate the opportunity to share. I did have an opportunity to connect with all of our kind of shelter systems. Welcome Home, Blackburn Center, and of course Union Mission are still continuing to operate. We are operating at capacity and still being able to connect people to housing. It's a little slower than normal, but we're still helping folks get connected and being able to turn over spaces for future folks. It's important, I think, to reiterate at the top of the conversation, Alyssa had pointed out that by calling 211, folks can access and get connected to our cold weather shelters. And that's a really important thing this time of year, especially with shelters operating at near capacity or being at capacity, that folks that are in need of that shelter have that opportunity. So they can call 211. It's easy for everyone to remember and easy for them to remember. So the 211 will connect them with the appropriate resource to make the connection for that sheltering option. You've heard a lot of conversation about the economic impacts and the concerns around rental payments. The rental assistance program, the rent relief program that was through the CARES Act and PHFA did end. And November 4th was the last deadline for applications, and the funding had to be distributed fully by November 30th so that they can wrap things up and meet the end of the year guidelines. There was about $1.3 million in rental assistance that went out into our community through that program. That served about 55% of the applicants. And so we do know that there is a large percentage of households that are continuing to build rent debt, and that could be a concern. The CDC moratorium on evictions does end at this point in time on December 31st. There is ongoing conversation, for consideration of extending that. Certainly legislation is also being considered to extend the CARES Act spending deadline so that potentially unused funds could be redistributed for assistance. And of course, they're considering new legislation for additional funding disbursements. All of that's up in the air, so there's a lot of concern. This is a good time to write letters and engage with your local representatives to ask for those things, that extension on moratoriums, to develop strategies, not just to help keep our households housed, but to help make our landlords whole. There's kind of that two-piece thing that's going on, and landlords are having a hard time maintaining properties, and we don't want our rental properties to become absent or not available. Our county commissioners and Department of Planning have been working with community partners to strategize ways to bolster the homeless response system in the community and kind of prepare for next year. And they've identified and have some funding going out for a variety of those critical needs, both within the housing sector and adjacent to it, so to support what we need to do within that system. More specifically, a focus on that homeless prevention piece, so trying to, again, meet people once the moratoriums are ending to prevent homelessness and keep them housed, or to help remedy those situations. Rapid rehousing services as a priority to help folks who do get displaced very quickly to get back into housing, and a focus on ensuring solvency for the shelters, to make sure that they continue to have the means to operate successfully and are funded to get through the same things Bud talked about with the hospital systems and capacity in terms of staff. Shelters go through that same concern, and making sure we've got that 24/7 staff to operate those programs and meet the needs of our clients. So we continue to keep moving forward as we always do. We do have the homeless point in time count for those that may be familiar or some awareness of that. On an annual basis, typically we have conducted in January a homeless point in time count. That date is set forth for us by the Housing and Urban Development. This year will be January 27th. And so we are working to kind of do a mixed methodology this year in our approach for that. we felt it was important to continue with some of the trends that we've done in the past. And so we're going to be working to set up a few sites scattered throughout the community that can provide all of the metrics for social distancing and safety for folks, but that people can walk into to get connected to emergency shelter services and to have some assessments done. We are also looking for volunteers who will be able to go out. So if you have an interest to get dressed up on one of the coldest nights of the year and join us as we go out to try to find folks who are, in known places. We will provide some training on that, and again, make sure that you have any protective gear necessary. So we will make sure all of that's taken care of for you. If you have an interest in that, please just reach out to me and we'll get you in the queue for that. But that's really all I have to report on. I appreciate the time.
Thanks so much, Dan. Appreciate it. I know at the Community Foundation of Westmoreland County, we're having conversations about the end of the moratorium and that concern about folks receiving eviction notices as soon as that ends. So figuring out ways that we can advocate for that. So more information to come from the Community Foundation as we figure out best ways to advocate to ensure that folks can stay in their homes, and as you said, that those landlords are made whole as well. So thank you, Dan. Appreciate that. We're going to round this out by moving on over to Jordan, who's helping us from the Hill Group in helping to lead the study in partnership with the United Way of the human services sector. Jordan?
Bill, thanks, and good morning, everybody. Thanks for having me. So I have harassed many of you to complete the Human Services Assessment Survey over the last couple of months, and I really appreciate the time and effort that many of you have put into it. We had about 30 complete responses, which was pretty good. And more importantly, it was pretty clear that those 30 or so complete responses were substantive and provided us some really interesting information to jump from for the purpose of assessing human services in the county. So I just want to tell you a little bit about what we've learned so far, much more to do, and where we are in the process, and then ask for your help. So what have we learned? Not much is very surprising, particularly to the probably the 80 people on this call, right? We're doing a decent job in human services in the county, but there are obviously some areas that could be improved. A lot of the survey respondents and a lot of our interviewees over the last couple of months have mentioned things like collaboration and cooperation, like the structure of human services in the county. Of course, funding and siloed funding comes up in our conversations. We've talked a lot and have read a lot about case management throughout the county and dealing with complex cases throughout the county, and a few other themes that continue to come up. And so what does that mean for our process where we are assessing this ecosystem of human services in the county? Well, that's our current state, right? The survey and our interviews are helping us understand where Westmoreland County is today. We're also working with the steering committee, many of whom are on this call, to envision the future, right? Understanding the current state, sure, that's important, but understanding where we want to go as a county, as a service ecosystem, is probably more important. And so we're in the middle of doing that right now. We're talking about things like the accessibility of the system and the structure of the system, and how as a set of providers and as a county, we can be doing this even better. We're taking a look at what about a dozen other counties around the country that are similar to Westmoreland County are doing. And lo and behold, there are some great practices out there that we might be able to borrow. And so we're bringing those into the conversation as well. And then finally, what we'll be doing is putting out some strategies, some recommendations of how, as a county and as an ecosystem, we can move from where we are today to that desired envisioned future of a world-class human services ecosystem, so that everyone in Westmoreland County who needs support and needs services can get them. So that's where my call for help comes in. I've changed my name on my screen to my cell phone number. And if you have anything you'd like to share, please write down that number and give me a call anytime. Here are my questions for everyone on this call. What ideas do you have? What best practices do you have? What have you seen in other places or heard about in other places that might work well in our human services ecosystem? No wrong answers, no bad ideas. Anything you have could be really helpful in helping us to make recommendations that will shape the future of human services delivery in Westmoreland County. And so please give me a call and we can chat about that. That's all I have for today. I look forward to talking to you again next month.
Thank you, Jordan. I appreciate that, and I know that you're working really closely with United Way, and Alyssa's helping to lead that lead this effort, and which I'm really appreciative of. But I also think it's important to know that this isn't living in a vacuum. That in the sake of transparency, some of the funding to do this work has actually come from the county, which tells me that the county commissioners are fully on board in really thinking about our human services sector and the way in which we operate. So I say that because it's an opportunity for all of us to work together, both in the nonprofit sector as well as at our county government level, to really think about the ways in which we support the most vulnerable populations in our community. So thanks for helping with that work, Jordan, and I encourage everyone to step up and get involved, lean into it. So. Well, thank you so much, everyone, for joining the call today. Alyssa, Sarah, do you guys have anything left, or are we good at this point? Anything come to mind?
All good here. Thanks, Phil.
Okay, great. Well, wonderful. As you can see, we've extended the calls to go through January, February, and March. At that point, maybe we can reassess at that point and see, but it seems to me that with the surge, it makes sense to continue our monthly calls to continue to stay on the same page. So we're going to go ahead and extend these calls for another 3 months, January, February, and March. Again, second Thursday of the month at 8 a.m. To remain consistent. If there are others that you think need to be on the call, make sure that you let us know, send them our way so we can get them all hooked up and ready to join us. So. After this call, we'll make sure that we answer any of the questions that you've submitted. If you have additional questions, you could also just email those to us directly, and then we'll send out a follow-up email. Allison Wolmer, our administrative assistant at the Community Foundation of Westmoreland County, will send out a follow-up email as she does with the links as well as with the other items. So I think that's all I've got for you. Thank you all so much for your time, and let's stay safe out there. Thank you.
Thank you. Bye-bye.